this little presentation and why I posted that, because I've gotten several direct messages on the Facebook page about lingering symptoms and what may be the cause of lingering symptoms. And so I just started doing some research, and I came across a couple of papers I just wanted to share with you that discuss the impact of traumatic brain injury on turning on the immune system in an abnormal way, which causes what's called autoimmunity. So just to go over a little bit about traumatic brain injury, I've posted some of these diagrams before. They're from Nature, journal Nature. They're really nice. They kind of put everything together. But what we'll be talking about tonight is we're just going to talk about some mechanical changes that happen in the brain, as well as some chemical changes in the brain, which can what's called like upregulate the immune system to create autoimmunity against certain brain structures and tissues. So as you know, in a traumatic brain injury and a concussion and a mild traumatic brain injury and a small head bump, your brain's going to kind of slosh around within your skull, and lots of things can happen. So you can get some axonal injury, which you see up here, which is, I'll show you a little bit about that in a second. Initially, you'll have activation of microglial cells, but then you can get ramification or increased activation or prolonged activation of the microglia cells. You can get microhemorrhages within the brain if there's contusion with severe trauma. You can get tau protein aggregation. So with tau and these A beta accumulation proteins, it's a bad thing. This is what you see in neurodegenerative diseases like in Parkinson's and in Alzheimer's. You can see these accumulations, and when the proteins aren't recycled appropriately, you can get dysfunction within the nervous system as well. And that can happen with traumatic brain injury. It's almost like the garbage kind of builds up and no one's there to take the garbage out. And that can cause a lot of dysfunction. And then you can get what's called like reactive oxygen species that kind of stick around and cause inflammation within the system. So lots of things can happen, which can lead to all the symptoms that patients have, which they can be brain fog, difficulty with concentration, difficulty doing motor activities, performing certain tasks. So lots of things can happen after these things begin. And with autoimmunity, you're really looking at some of the prolonged activation of the inflammatory responses in the immune system. But just to kind of touch on the mechanical side of things, like we said earlier, the brain's going to go forward, backward, side to side. So you get these, you can have what's called coup contra coup injuries. Within the brainstem itself, the brain can kind of slosh around and cause twisting on the brainstem, which can cause axonal injuries with communication from the brain down to the brainstem and then out to the body. So what it shows here is that within like a shear injury, you're going to get shearing forces, which can cause neuronal damage or axonal damage. And then you can also get traumatic axonal damage where there's twisting, there can be pulling of the axons. And this is stuff that you may not necessarily see on MRI or CT scan. So I work with a lot of motor vehicle accident patients, and they'll get their scans done and then they're told everything's fine, but they're completely symptomatic and they have all the signs and symptoms of concussion, but they're being told sometimes that, you know, hey, everything looks good up there because there's no physical bruising, when in fact it's more of a silent injury and things are happening inside the brain that you can't see that's causing a lot of these problems for patients. So concussion and mild head injury, just to kind of talk on, you'll see if you read some of the research, they talk about secondary neuronal damage. And this kind of comes from those microscopic effects like you can't see on a big scan. So some of the macroscopic stuff you see is where you have skull fractures. This is less macroscopic, but you have dysfunction of the blood-brain barrier, which we've talked about before. You can get contusions of the brain tissue, and the shearing forces can disrupt the actual axons and the neurons within the brain itself. But then you also have some inflammatory responses. So here you get neurotransmitter release, calcium influx into the cells, which can cause hyperexcitability. And then you get all these metabolic cascades that can happen. And inflammatory responses initially are there to help protect and kind of clean up the garbage. But when these become prolonged, you can have things such as mitochondrial failure. You can get reactive oxygen oxidative species formation and free radical accumulation, which can cause more inflammation within the brain. Interestingly enough, there could be altered genetic expression. So you have genes, and then genes are affected by the environment. So if there's a negative environment within the brain due to inflammation, it can alter the genetic expression of what's supposed to be happening in the brain, and it can upregulate inflammatory mediators. And then you also get cell death and transneural degeneration, which ultimately can lead to brain failure. So it can be a pretty frustrating thing to have, because fortunately, concussion and traumatic brain injuries, there's more light being shed on it, but you can't see this stuff. It's very microscopic. So if you feel as a patient that something's not right or something's off, you know your body best. So just continue to look for some resources or the right type of practitioner to help you figure out the answers, because there are answers. So the question then is, like, what happens with autoimmunity? What happens within this brain to cause an autoimmune response? Because inflammation is one thing, but then having an autoimmune attack on brain tissue is a whole other thing that can be very difficult to manage and to try to reduce symptomatically. So this is a paper from 2017 called Autoimmunity and Traumatic Brain Injury. So what this basically talked about was different protein markers that you can look for within different types of testing to see if there is autoimmunity against brain tissue. So what it talked about, which we'll talk about a couple of these tonight, increasing evidence shows that in a subset of TBI patients, there are circulating autoantibodies recognizing a range of brain proteins, including glial proteins like S100B, fibrillary acidic protein, and peroxyredoxin. And then neuroreceptors such as glutamate receipt subunits NR1, and then oligodendrocyte originated myelin basic protein. So it's a bunch of big words, but basically they're little proteins that you can look for on specific blood work to see if there's some sort of autoimmune response to the brain. So this is the image, one of the images that comes from the paper, just to show you what can kind of happen. So what happens, obviously, there's some sort of brain injury, and I'll kind of just read off of here. So this is called the schematic of the genesis of autoantibody response following traumatic brain injury. So you have the initial mechanical damage, which results in rupture or necrosis of vascular tissue. That can lead to some blood-brain barrier damage acutely, but long-term blood-brain barrier disruption may occur as a result of sustained local inflammation during the secondary phase, which they're kind of describing down here. And when they're discussing the secondary phase, basically it's kind of like unchecked or unregulated inflammation, or it can come from second impact syndrome, anything like that, where the environment within the cells or around the cells is a little bit more inflamed than it should be. What can happen with this is you can get increased blood-brain barrier dysfunction, which we've talked about before. The blood-brain barrier is a protective mechanism to keep all the things outside of the brain from the peripheral system and vice versa. And when those doors kind of open up, or there's little holes poked in it, bad proteins can get in, inflammatory mediators can get into the brain when they shouldn't get in there. And that can cause a lot of brain dysfunction. I tell everybody, when there's inflammation in the brain, it's almost like trying to have a conversation in a thunderstorm. Your brain just can't communicate the way that it did before. So what can happen further on is that this can lead to some sort of autoimmune response within the brain, which can be difficult to deal with. So same paper, interestingly enough, this paper discussed how most of the research, most of the published evidence supports after a traumatic brain injury, there's autoimmunity that goes against the hypothalamic pituitary axis. So you get autoimmunity to some really, really important communication centers between the brain, the pituitary gland, and the rest of the body. And just as a reminder, the hypothalamus is up here. You're going to have communication with hormones to the pituitary gland, both the anterior and posterior pituitary, which goes out to a whole host of important systems like the bones, reproductive organs, breast, ovaries, testes, the adrenal glands, your thyroid gland, kidneys. All those areas are communicating with the pituitary gland. So you can imagine if a traumatic brain injury caused autoimmunity, which most of the evidence shows it causes autoimmunity against the hypothalamic pituitary axis, you're going to get dysfunction possibly in some of these areas as well. So that's just, right there, it goes to show you like, hey, if you bumped your head and you're still having symptoms, and some of these symptoms can be related to some of these systems, maybe autoimmunity is a component that's further driving these issues that you're having from your brain injury. And then I'm just gonna show you a couple of these tonight. This is a really, really short talk, but this paper in particular, it's the same one from before. It just listed a couple of candidates for testing, and the ones that I'm gonna talk about are GFAP and S100B. So the question is, hey, if there are autoantibodies to the brain, and maybe what I'm feeling and suffering from my traumatic brain injury is an autoimmune response to brain tissue, how can we look and test for it? So I'm sure there's several tests out there, but one that I've used that I'm familiar with is the Vibrant Wellness Neural Zoomer Plus. So several weeks ago, I had Dr. Tom O'Brien on here, and he talked about how when he was living in Costa Rica, he just read through tons of research and realized that this is something that should be tested. So he helped put together this test for Vibrant Wellness, and it's pretty cool. It's a very comprehensive test. And that's not to say there's others out there that are great as well, but this is just one way to be able to say, hey, I'm still not feeling great. I've kind of been written off. I've been told like most of my symptoms, they'll get better on their own or whatever, but maybe I do have autoimmunity against my brain tissue. Here's a test that you can do to do it. And just to mention, we've got the anti-S100B test that the test can run to see if those autoantibodies are an issue. And then you can have the anti-GFAP test ran as well. This will also test for other things such as antimicroglial antibodies, and then something else called anti-glucose regulated protein 78. So this is just to show everyone who's following this page, if you're suffering from those symptoms and you've been told you've had all the tests and everything, it's just a reminder, hey, there's some other stuff out there that you may want to look into. Now, if you do test and you have brain autoimmunity, the question is how can you address autoimmunity? And that's kind of a discussion to have at another time. But I think one of the best places to start is by trying to address the autoimmunity itself. And when there's autoimmunity inflammation within the system, looking into doing alternative practices like functional medicine might be of great benefit for people. So this was a paper that came out again in 2017 from Alice Richer, and it's the functional medicine approach to traumatic brain injury. And this is not to say, hey, if you have autoimmunity, go take all these supplements, you're going to feel great. This is just to show you that there's other options out there besides, sitting in a dark room for long periods of time or medication to help with your symptoms. Really trying to get in, figure out what's wrong, what's driving the autoimmunity is one thing, and then supporting the system and supporting pathways with different nutritional supplements, dietary interventions, and different types of mindfulness practices or other types of therapy may really, really benefit a patient that's suffering from autoimmunity induced by traumatic brain injury. So that's kind of what I wanted to share with you tonight. And I reference all the papers in here. This is just a list of some stuff that they mentioned in the paper. Again, this is not an end-all be-all. There's obviously further research that needs to happen with some of these things and some of these suggestions. And she does mention that in the paper. So please don't take this as a, hey, go do this and you're going to feel great, because if it were that easy, I think everyone would be feeling better who've suffered from traumatic brain injury. But what I wanted everyone to kind of gather from this little talk was just to say, hey, autoimmunity could be a component in the symptoms post-traumatic brain injury. It's something that should be looked into. It is something that can be tested for, and then there are treatment options, not necessarily to make everything go away, but to help support systems and make your brain work better and feel better. So I hope everyone's doing well, and I'll talk to you guys soon. Thanks so much for